Hello, so this is obesity in America. Are factory farms, big pharma, and big food to blame? One-third of our economy thrives on making people sick and fat. Big farmers grow 500 more calories per day, per person per day than 25 years ago because they get paid to grow extra food even when it's not needed. The extra corn, and soy are turned into industrial processed food and sugar sweetened beverages, combination of fat, sugars, and salt that are proven to be addictive. These subsidized, cheap, low quality foods are heavily marketed and consumed by our ever widening population, with an obesity rate approaching 3 out of 4 Americans. The more they eat, the fatter they become. The fatter they become, the more they develop heart disease, diabetes, cancer, and a myriad of other chronic ailments. Today, 1 in 10 Americans have diabetes. By 2050, 1 in 3 Americans will have diabetes. The sicker our population, the more medications are sold for high cholesterol, diabetes, high blood pressure, depression, and many other lifestyle-driven diseases. The toxic triad of big farming, big food, and big pharma profits from creating a nation of sick and fat citizens. This structure is built into the very fabric of our economy and culture. It could be called the medical, agricultural, food, industrial complex. It is what is known as structural violence. The social, political, economic, and environmental conditions that foster and promote the development of disease. But there is a way to turn the toxic triad into a health trinity. Through innovation and creativity, we can create a new economy based on products and services that make people thin and healthy instead of sick and fat. Businesses can do well by doing good. We just have to change the default choices and behaviors both at the policy and the grassroots level. I learned a few things about this in Haiti from my friend Paul Farmer. This wasn't actually me who wrote this article, this was actually someone else's article, so I've never been to Haiti. But this is just talking about his experience there and what he learned and how we can kind of utilize some stuff here. So, addressing structural violence. When this individual was in Haiti in January 2010, after an earthquake, I visited Zanimi. The health center started in 1980 by Dr. Paul Farmer. Much of the world's amazement, he showed how, in one of the poorest places on the planet, he could successfully treat complex infectious diseases such as tuberculosis and AIDS. The conventional wisdom was that the poor people sleeping in the mud floors would not take complex regimens of medication, so he should essentially leave them to die. The problem wasn't that doctors didn't know what medications to prescribe, but that poverty and social conditions such as lack of access to healthcare, food, shelter, jobs, clean water, and sanitation prevented effective treatment. Paul Farmer didn't accept this. Through his foundation, Partners in Health, with the help of Clinton Foundation and the Gates Foundation, he demonstrated the flaws in conventional wisdom and has successfully treated impossible to treat patients in impossible conditions around the world. He did it because he addressed one simple thing: structural violence. To successfully treat people in Haiti, Paul Farmer did not simply focus on what medication regimens were needed to cure tuberculosis and treat AIDS. He accompanied patients into their lives by using local trained community health workers. He helped patients change the conditions of their lives, find shelter, food, jobs, clean water, and sanitation, all necessary structural changes that allowed for effective treatment. He addressed the system, not just the symptom. So this goes actually back to the hierarchy of needs, Maslow's hierarchy of needs. It's really hard to take care of that, like your medications and stuff like that, when you're so focused on, I need food and shelter. We must do the same if we're serious about addressing the wave of chronic illness sweeping across the world. We must focus not only on the individual, but the system that has created 1.7 billion overweight citizens worldwide if we are to slow and reverse the national and global epidemic of obesity, diabetes, and heart disease, threatening not only our health, but the survival of our economies. Big food and farming and pharma, how they are killing us. The default condition of a human being in the 21st century is to be obese. Nearly 75% of Americans are overweight. This is not an accident. Specific traceable forms of structural violence promoted by big food, big farming, and big pharma and government policies is leading to the global spread of obesity, diabetes, heart disease, and cancer. Current food policies and subsidies encourage big farming to overproduce corn and soy, which are then used to create sugary, fatty, factory-made industrial food products sold as processed fast or junk food, as noted above. The government essentially stands in line next to you in fast food chains, helping you buy cheeseburgers, fries, and cola. But in the produce aisle, in your market, you are on your own. The 2010 Farm Bill offers little support to farmers for growing fruits, vegetables, and healthy whole foods. The restaurant omnipresence of cheap, high-calorie, nutrient-poor processed foods in homes, schools, government institutions, and food programs, and on every street corner creates default food choices that drive obesity. So, how can you eat fruits and vegetables when you can't buy them in your neighborhood convenience store, or their price has increased 5 times as fast as sugary sweetened beverages? Big food takes advantage of this glut of processed food to drive up profits through the use of mass media technologies. Other than drinking sugary sweetened beverages, the number of hours on screen time and television watching is the single biggest factor correlating with obesity, which in turn drives the diabetes epidemic, in addition to the metabolism slowing hypnotic effect of watching television. Relentless food marketing focused on children is one of the major factors driving this problem. The average 2-year-old can identify by name junk food brands in supermarkets, but many elementary school children can't readily differentiate between a potato and a tomato, as Jamie Oliver recently demonstrated. Big Food claims that the problem is one of personal responsibility, that processed foods can be part of a healthy diet as long as they are eaten in moderation. But the more we delve into the research on food marketing practices, the impact of food deserts, where healthy food simply can't be found, and the biological addictive properties of the overly available, cheap, highly caloric, nutrient-poor junk. Yeah, sorry about that. My cat was being a pain in the butt. It becomes it becomes the environmental factors override our normal physical and psychological mechanisms that control weight. As I explained in my recent blog on food addiction, it is not a failing on personal responsibility, moral fiber, or willpower that drives people to overconsume these unhealthy foods. Industrial processed food has been found to be addictive. We are like rats in a cage with unrestricted access to processed sugar and fat. When given a choice between cocaine and sugar, rats always chose sugar. So do we. Poverty and food scarcity also drive poor food choices and are linked to obesity and diabetes. The poverty rate in 2009 was 14.3%, the highest since 1994. As I pointed out in my article, not having enough food causes diabetes. There is a correlation between the poverty rate and the obesity rate, and the poorest state in the nation are the fattest. The government's approach to these issues echoes big food. Government interventions like industry initiatives are predicted on education and encourage personal responsibility. The rhetoric is that regulating the food industry strips away our right to choose, and that the market should be self-regulating. It's true that market-driven forces often do effectively control commerce. Companies can produce and sell poor quality products, and if consumers choose to not buy them, the market regulates itself. Companies begin supplying what consumers demand instead. This model works in our society unless those products affect our health, safety, and the greater social good. In this case, we expect our government to step in and take action. Consider cars or medication. The government has mandated the production of safer, less polluting cars and protect us from harmful medication. In cases like these, government regulation is accepted. Poor diet causes many more deaths than auto accidents. Yet, as a society, we resist government regulation over big food. Why? I don't know how much it is really government regulated, but I think after reading about how much pharma and farmers and stuff, they get a lot of money if they do corn and those sugary products. But they should also get a lot for veggies and stuff. I'm not going to read directly off of this, but that's basically what it's saying. And then this is a list of things that, so like industrial processed fast and junk foods is addictive, which is one of the things it's saying. Big pharma's influence over the global increase in obesity. They promote the growing of cheap corn, soy, which is turned into sugar, and high caloric things instead of vegetables. An ethical manipulative food market that drives eating habits, and poverty's relationship to obesity and diabetes. And it also mentions how obesity is contagious. You're more likely to be obese if you have a fat friend than if you have fat relatives. Social norms promote weight gain. The destruction of family kitchen and home cooked meals. Environmental toxins. Important initiatives have been created by the Obama administration within the healthcare bill and Michelle Obama's Let's Move program that make a beginning of the shift that needs to happen in our food climate. But to really change our obesogenic environment, we need to create healthier default choices for citizens. We must focus on specific actions we can take personally and politically to alter our food landscape. So what can we do to create a healthier nation and world? So this is just some of those. So eliminate unhealthy foods from all schools, childcare, and healthcare facilities, and all government institutions. Stop food advertising to children. Develop more funding for nutrition science. And change the farm bill so that agricultural policy should support public health and encourage the production of fruits and vegetables. Lobby reform, tax sugar. If we had a sugar, scientists actually suggest a penny an ounce tax on sugar-sweetened beverages. This would reduce consumption, obesity, healthcare costs, and promote revenue to support programs, and end irresponsibility relationship between medicine and industry. Perhaps the most important initiative we can enact is the creation of the Health Corps for the nation, a workforce of community health workers to educate and support sustainable change by addressing structural violence in homes, schools, and workplace, in most institutions by following Paul Farmer's model in Haiti. We would create jobs, improve health, and lower healthcare costs. So this is just the end of my video. So with appropriate checks and balances put in place by government, it can become profitable to create products and foods that create and promote health. When this happens, the toxic triad can become a healthy trinity. So I hope this makes sense. Thank you for watching.